Hi, I'm Dr. Tom Denisowitz with Airrosti, and we're going to talk about elbow and wrist pain. Now, all the information we're about to discuss comes from our live free webinar series, where every month we talk about a new injury or condition, and if you want more information about that, please click the link below. Without further ado, let's get started. Here are some interesting facts about elbows and wrists. You are more likely to develop a pain on your dominant arm with elbow and wrist pain compared to your non-dominant arm. You are far more likely to develop tennis elbow or elbow pain on the outside of the arm opposed to golfer's elbow on the inside part of the arm. In fact, 7 times more likely on the outside. Males and females get elbow pain at about the same rate, but unfortunately females do tend to suffer with more wrist pain than males. And carpal tunnel is a huge issue. In fact, it's the second most leading cause for surgery for musculoskeletal condition in the United States. Let's talk about some common misconceptions of elbow pain and wrist pain. First, you've been told you've got tennis elbow, but you don't play tennis. It's a common misconception. You don't have to play this sport to get this diagnosis. What's really going on is you have irritation or inflammation to the tendons on the outside part of the elbow, and often the problem is just due to a mechanical issue. Or you don't play golf, but you've been told you have golfer's elbow. Again, just irritation or inflammation to the tendons on the inside part of the elbow, often due to something going on above the chain or below the chain. A lot of times patients will complain of hand or wrist pain and automatically assume they have carpal tunnel. But there are a number of different conditions and pain syndromes that can occur in both the wrist and the hands. It's not all carpal tunnel. And lastly, people who develop wrist and hand pain sometimes assume it's due to the overuse of typing, but typing does not actually directly lead to that mechanical fault. A lot of times that problem again can be further up the chain, even such as a posture or sitting position. We'll talk about some of the common root causes to very common elbow and wrist conditions. So we talk about lateral epicondylitis or tennis elbow, that irritation of the outside tendons, or golfer's elbow, irritation of the medial tendons, or carpal tunnel, where you're compressing the medial nerve due to irritation to the bones and ligaments of that area. Maybe you've got a little bit of lateral wrist pain and it's getting irritated to the ligaments, or the tendons on the thumb are getting irritated. Those are all very specific problems, but often they have similar underlying root causes. Maybe we're dealing with a little bit of tightness or weakness at the shoulder. Maybe that's due to our posture. We're hanging out on the phone a little too much, or we're just constantly in this forward position. Or maybe it's the wrist is getting complicated here with bad positioning. So it's not the idea that we're typing. Maybe it's the idea that we're kind of leaning into that desk and kind of relaxing a little bit as we're typing, or the desk is not sitting at a level that's appropriate for you. That's putting that increased stress and strain that will then lead to wrist issues and elbow issues. And again, those can be very specific, but they have a common underlying root cause. We hope this video has been helpful. All the information has come from our live free webinar series, where we go over a new injury every month, give you some simple exercises to try at home, and finish with a live question and answer feature where you get to ask your questions to one of our providers. For more information about that webinar, please visit airrosti.com/webinars. Thank you very much. We'll see you next time.